Welcome to the COVID313 Coalition for Families and Students. I'm Christine Bell. I'm honored to serve as the Executive Director of Urban Neighborhood Initiatives, and I'm a proud partner of this coalition. My heart is definitely heavy today as a parent and a person that's worked with young people my whole career. I'm so deeply saddened by what we saw in Oxford. We'll talk a little bit more about that later on in the program. We do have an exciting town hall today. We'll hear from our doctors, and we will also hear from DHD and our schools as things are moving really rapidly at the moment as it relates to COVID. But before we start, like always, we want to hear from you. So if you have questions or comments, please engage with us in the Facebook chat. Lindsay and Michael and I believe Brooke are ready and waiting to get your questions and comments to us so that we can share them with our experts. So to make sure that they are fully ready, will you please let us know how you heard about the town hall today? Like always, we are translating the town hall into ASL and Spanish. And so we want to give folks time to get to the right place. So Julie, it is so good to see you today. Will you please share the instructions for ASL? Thank you so much, Julie. It's great to see you today. And Cristina Guzman, could you please share the instructions for folks to listen to Spanish interpretation?
Buenas tardes todos, bienvenidos a la reunión de COVID-313. Para escuchar en español, ustedes pueden ir en el Facebook Live de UNI o hay un adjunto enlace en el chat para que ustedes puedan participar. Gracias.
Thank you so much, Christina. It's wonderful to have us with you again today. We are really lucky that you join us on Thursdays these days. Okay, so we would ask Wes Jones to please mute yourself. Or if Molly, you could mute Mr. Jones, that would be great. And I am going to turn this over to one of my co-moderators, Rajeshri.
Hi, thank you, Christine. Good afternoon, everyone. As Christine said, all of us have heavy hearts this morning as we reflect back on what's happened this week in Oxford, what is happening around us in neighboring districts as we see school closures due to, out of an abundance of caution. As a parent, I know it makes me want to hug my child even tighter. It makes me really reflect on, her safety and what can I do to make her feel safe. As somebody who's worked in schools and whose job it has been and whose responsibility it has been to keep our children safe, be reassured and know that schools and teachers and principals take this extremely seriously. So what we can do now is all work together to make sure that we are doing everything possible to keep our kids safe and be supportive of one another. Also encourage you to bring up any questions or concerns you have directly with your school and allow them to reassure you and tell you what's going on. Later today, we'll have some school folks on and we'll talk to them about that. But to acknowledge what we've all been through and to acknowledge and honor the memories of the children who lost their lives this week, we ask that everybody join us in a moment of silence to reflect. Thank you. Thank you, everyone. Today's town hall is going to be full of information. And again, our purpose here is to bring you enough information so that you can make your own informed choices and answer any questions that you have. As a reminder for our experts today, please remember to speak slowly for our translators. They really want to make sure that they capture everything that you say correctly. Also, for our experts, please make sure you turn off your camera and your mic when you're not speaking to ensure that our ASL interpreter can be seen. Terry Whitfield is our timekeeper today. He will chat with you during your remaining time, and if you go over, one of us will gently remind you to wrap up. We thank you for being here. Without any further ado, I want to hand it over to my co-moderator, the amazing Jametta Lilly, who's going to bring on some representatives from schools to chat with us a little bit about what's happening now and what plans are as we all battle COVID-19 together. Jametta, I'll turn it over to you. And there's two of you.
Yes, there are two of you. Rajeshri, if you would. Thank you for the mute back there. So we want to let you know that in this incredibly challenging time, as we know, Rajeshri, you've laid out for us that our hearts are heavy. And we know that the work that the schools have been engaged in has been extremely challenging because their parents, like many of us are parents, and they are struggling to try to make sure that our kids are safe. Not only in terms of the bizarre and unprecedented level of violence that's increased in this country, which includes guns in schools and people who have no use or right even to have a gun of a weapon of that nature. But we know that our schools are really struggling with that. And we want to let you know that, as always, we are happy to have leaders who are thoughtful, who are engaged, working with our children and families. So with that, we are really pleased to welcome back to the program Crystal Wilson from the Detroit Public School Community District, and also Ralph Bland with the New Paradigm for Education. So if both of them could come on screen, we'd like to welcome you.
Yeah, Jametta, it looks like they have both been held up. So perhaps we can move on to Tanea with the health department and come back to these folks when they are able to join us.
Okay, certainly. So what I'd like to then do is, Rajeshri, I'm going to go ahead and pass it back to Christine to bring in the amazing Tanea Hackney, who's such a part of our work around COVID with our Detroit Health Department.
We gotta love our little team here, right? We just keep passing the ball back and forth and we're good.
We are not going to let technical difficulties take us down. Okay. Okay.
There's one thing that we've learned in COVID is how to be very flexible. Tanea from the health department is with us, and she has some really amazing information to share with us about testing, and I think she might give us an update on numbers. So Tanea, as I know, you always come with a PowerPoint. So do you want to share where we're at in Detroit right now as it relates to COVID?
I actually don't have a PowerPoint.
Oh.
I do have a slide. I wanted to talk more. I do have data, of course. I do have one PowerPoint that's important when we talk about different types of COVID testing. But first, I wanted to give the data because, again, that's always relevant to what we are. Our numbers are trending. They're almost double. So let's give some numbers. As of November the 29th, believe it or not, we're right now in the city of Detroit at 16.9. I believe just last week, we were just at 9.9. And the week before, we were at 5.9. And because of the holiday, that break there and us meeting and the reports not coming in properly because that little break of the holiday, the spike 16.9 is scary. And that's in the city of Detroit, where our numbers, again, were really low. And that's within a 5-week span. So to go from 5 to 16.9 in 5 weeks We need to remember that masking, of course, we want to encourage the vaccine. Hand hygiene is important, social and physical distancing. And, you know, I want to include that ventilation is vitally important as well, because we know that COVID is spread through droplets. And if we have proper ventilation, a fan or a window open, yeah, it's cold, but, you know, the most important thing is ventilation. And that's a recommendation from the CDC, especially for the holidays when we're talking about meeting, masking indoors. That's recommended, strongly recommended from the CDC, Michigan, definitely from the Detroit Health Department. The other, I believe there was other questions, Ms. Bell, about testing and the testing
Yes.
infrastructure.
So I know that you have a slide. So I'd love to run through some scenarios with you. So if we could put up Tanaya's slide. And so let's take, you talked about the holidays, and it sounds like, you know, we've had a steady increase in our positivity rate. Those were the numbers that you just gave, the positivity rate, meaning that that's how many people have tested positive for COVID in the last week. So let's take the holiday for example. You want to go to your family's house. Some people are vaccinated, some people aren't vaccinated. You want to make sure. I'll just actually give a real example. My husband had a runny nose at Thanksgiving. He was going to be around my 90-year-old aunt, a number of our children and others that are not vaccinated. And he also has exposure because he's a first responder. So which one of these tests should he have taken and why?
The most important thing I want to encourage, or we want to encourage, is to take a test at least 72 hours before you meet with someone. Say for Thanksgiving, we know that was last week, but we have Christmas coming up. We have New Year's and New Year's Eve, or just some of us are delaying some of our holidays. But that meeting should encourage any of these tests within 72 hours. I will say any test that we take is not 100%. So we can take a PCR test. It may not come back positive. It may not come back negative, but that doesn't mean that it's correct. So we would encourage those that are having symptoms, if you're not sure, the best thing to do is stay home. If you're sick, unsure, you've been tested, if it says negative, stay home.
And in terms of the testing, Tanea, that the city is offering, which one of these tests are the city offering and where are they offering them?
Well, at the city, we're offering at the Joseph Walker Williams Center, which is located at, I have the address here somewhere, at Rosa Parks Boulevard. I believe it's 8421 Rosa Parks Boulevard. And anyone can schedule. It does need to be scheduled for that testing at 313-230-0505. There are other locations throughout the whole Michigan, and the easiest thing to do is either go on Michigan, I got it wrote down, michigan.gov/coronavirus test. If you pull that up, you'll put in your zip code. It'll give you the nearest location to you. If you're not sure how to operate that website well, there is a number for it also. The number for it is 535-6136. And there's an option, number 2. They will assist you with finding a site close to you. Because again, we have to remember, some of us work in the city, but we may not live in the city of Detroit, but we still have to protect the city. So we're giving out that number as well as a resource.
So Tania, did I hear you correctly that the city only has one testing location?
We do, but we have, that's for the public, but we do have a outreach testing team that is going out for congregate care. We have resources for congregate care backup because there's so many care facilities. One of them is COVID control that are assisting us going into facilities. Our outreach team is also helping train those through teaching them how to administer the Binax Now antigen test for training. There is also, what else? For schools, the public schools, they have their own testing system, and that's how they keep track of theirs. Detroit Public Schools. So there's where we need assistance is, we have other sites. Again, there's so many different sites that the easiest one is to pull up the michigan.gov site, and there's a lot of them in the city of Detroit.
So that site will tell people where the health department is testing, but also where, if Rite Aid, if you can get a test at Rite Aid or Walgreens or urgent cares. So it's the place where all testing sites, all the information for all testing sites is coalesced. Is that right?
Right. Including pop-up sites, because we have pop-up sites. That outreach COVID testing team I was referring to earlier through the Detroit Health Department, they're everywhere. So they may be down the street at a church. So if you put in your zip code, that will pop up as well.
Okay. So is there a plan in terms of Christmas and testing locations and hours? And what is the city's plan? What is the city's plan for that? I should say not just Christmas. There's a lot of holidays that fall during that time. So does the city have a plan for testing as it relates to the holidays that are coming up?
We do. The city of Detroit is encouraging getting tested if you're feeling symptoms or 3 days before whatever meeting you're going to. So say, because we will have closures because of the holiday, a lot of people want to spend time with their family and friends. So this Detroit Health Department will have closure times, and those times include December the 23rd through the 25th and December 31st. And we also have to remember that M's department, the vaccination pediatric team, will also have a closing time, December the 23rd through the 25th, and the 30th, the 31st, and January 1st. So we're asking people to plan ahead. Plan ahead, get your test, because although we have pop-up sites, although we have other things going on or offered, plan ahead. If you're going to meet, take your COVID test. One thing I do know for Thanksgiving, a lot of people were looking for home tests at CVS, Walgreens, Rite Aid, and they weren't there. So plan ahead. It's not guaranteed you'll find one.
I went to 4 stores. That was a real story about my husband. I went to 4 stores before I found a test for him to take. So plan ahead. And so let's say you get your COVID test a week before Christmas, or whatever holiday event that you're attending. Should you then quarantine once you have a negative test? Should you quarantine before the day of the event?
I would. You want to be especially careful. So what we do know that if you come across someone who is exposed that you know of, there is an incubation time between 2 to 5 days before symptoms come about, if you have symptoms. So we usually tell people to get tested on the 5th day. Why is that? Because if you're exposed and you get symptoms, there is a strong chance that the 5th day will show more positivity for you receiving COVID or not. So yes, be extra careful. You want to be extra careful anyway right now, because unfortunately we do have this other strand that is in the United States, Omicron, that as of today, through the Michigan alert, has been clarified as concern.
Okay. Well, Tanea, we are out of time. Just wanted to note that the health department is giving boosters. Can you give the number one more time so that people can call to make their appointment for their booster? What's that number that they call?
So for the booster, for the vaccines, for child scheduling vaccines, and also for COVID testing, you're going to use 313-230-0505. That number also helps those that are homebound to get vaccinated. They will also vaccinate anyone who is in the home. So if you want to have a vaccination party, do it now. With boosters, with child vaccines, let's do it. I mean, if we want to do it a party, let's ventilate, mask, and get vaccinated.
I think you just might have created a new way of getting people vaccinated, Tanea. So everyone, we really appreciate the health department. We really appreciate that you come on every week. And I am going to turn this over to Jametta Lilly, who is going to announce our next guest. Thank you so much, Tanea. Have a great rest of your day.
Thank you. You too.
Thank you so much, Tanea. And like Christine, I just want to underscore that the Detroit Health Department will come to you. So yes, get your family together, get comfortable, be masked up, and bring them so you can set aside your mask very soon after you make sure that everyone is fully vaccinated. Thank you so much. But thinking about planning, we know that we often try to plan as human beings, and then something extraordinary happens to change all of that. And so that makes us think about our schools that have been extremely planful as much as they possibly can be while responding to challenges and unknown factions and factors. So to help us kind of think about this and get an understanding of where our schools are, we're pleased to welcome back Crystal Wilson. Crystal is the Superintendent of Communications for the Detroit Public School Community District, and also Ralph Bland, who is the CEO of New Paradigm for Education. I'd like to welcome both of you back to the program.
Thank you, Jametta, and thank you all for being here with us week after week. As Molly was reaching out, I can't believe we started this March 2020 and it's still going. So that just speaks to the length of time that we've been coping.
And coping the best that we can. But let me hit pause. And I know, Crystal, that you have to leave. And Ralph, if you could give us a little bit of grace, we want to get these questions to Crystal. And then I'd like to pivot to you as another important part of our whole infrastructure to support education in the city of Detroit. So Crystal, how are you in the schools looking to reassure and support parents and students at this moment, given what we've seen horribly happen in Oxford?
Yeah, so we're encouraging our families and our schools to have conversations of support with the students. We happen to live in an urban area where, unfortunately, we probably have a very acute awareness of crime and violence that often surrounds our families. We know a mass shooting, however, is on a different level. And although Oxford is 45 minutes away, we know there isn't anyone that is inoculated from what happened the other day. So we're letting our parents and families know that we do have safety precautions and measures in place. We work very closely with DPD. One of the advantages of DPSCD is that we do have our own police department, and that we are on a border city with an international border. And so that brings about a great deal of resources to us as it relates to mitigating any type of threats, from bomb threats to shooting threats, social media threats. We're able to react very quickly. And we also are encouraging families to take advantage of the initiative. If you see something, say something. Don't wait. Go ahead and alert authorities if you see something. If you're wrestling with mental health challenges or emotional challenges, we have counselors available for our families, and resources and hotlines so that they can take advantage of that to try to provide them some relief and to tap down the anxiety that most of us are feeling right now.
That's very helpful. And I think a lot of parents haven't thought about the very unique resources that the Detroit Public School Community District and also the charters that are part of the fabric of education here have accessible to them. So, we've had some changes. We know that there's, Omicron. We know that we have had a pretty significant uptick in cases, and we know we've seen increased hospitalizations. So talk to us, Crystal, what's different in your COVID protocols right now and why? And then also, could you help us understand your virtual Fridays?
Yes, so I would just clearly state our plans have not changed. The one thing that the board and the superintendent did when they outlined the safety mitigation plan is that it needed to be flexible and nimble, but we also needed to abide by it with integrity. And so we're continuing along with the guidelines that we set forth in place that has helped us to keep the level of spread down. And from extensive PPE to the purification systems in the classrooms, the hand washing, the social distancing, the weekly COVID testing. We started the vaccine clinics again for those who are 5 years of age and older. We're having one Saturday so families can get their vaccines and get their boosters. We're working closely with the Detroit Department of Health and making sure that families abide by the quarantine guidelines. We did work with the city to make a couple of adjustments as folks are getting vaccinated, but we're asking folks to be faithful to those guidelines and get vaccinated. In terms of the online Fridays in December, we know that we received an outpouring of information and concerns from families and staff. Burnout is very real. Mental health is very real, and the need to keep our buildings at the optimal level of cleanliness is very real. So those Fridays will allow for us to continue that optimal level of cleanliness. It'll allow for the teachers and the students to have their emotional and mental reprieve day at home with online learning. And it'll allow us the space to regroup for the following Monday. So there's 3 Fridays this month where we will be going online.
Okay. Could you, in the next, so 2 lasting questions for you. Obviously, there's an existing plan. And as you've said, the whole point is to use science to be responsive and to be nimble. And there are times that you have to communicate very quickly with families. Could you talk about what are some of the best practices that you're trying to assure are in place to communicate what may not be changes to you, but are actually changes as perceived by the community? What are the best practices that you have in place and that parents can expect as you may need to engage them and inform them about any adjustments in schedules or opportunities for learning, as well as opportunities for the clinics that you have available?
Right, good question. In terms of communication, we have definitely been consistent with a weekly newsletter that we send out to families. We send a robocall at 6 o'clock every Monday, followed by a robotext with a link to the newsletter. And we place in that newsletter at the very top 5 things that families need to know. And in those 5 things are updates on the vaccine clinics, on the education sessions that are available. And we also use links to the protocols that we have in place as far as what happens when a school receives a positive COVID case, or what happens when the Detroit Health Department alerts us of a outbreak. And we communicate with the families so that they know what to do. The health department, they work with us in terms of contact tracing and identifying those who need to quarantine, and also determining how long they need to quarantine. So we work very closely with our principals. We try not to send out the robocalls in the blackout hours after 6:30 and before 6:30 the next morning. But if it means that we have to close a building or we need to alert staff and students, we do issue those robocalls. The last thing I would say to families, we know you have received a ton of robocalls. We're starting to really express that this is an important message so that they don't hang up on it. And so if you've opted out of the robocall or robotext system, we beg you, literally, I use that word as the comms person, to opt back in so you don't miss important messages.
Okay. And so we know we got holidays coming up and we have the holiday break. What's your plan now in terms of mitigating any of the spread, that we can perhaps be wise and know that we're going to have an uptick as a result of people being together throughout the holidays? What's the current plan in terms of addressing that when children return in January?
Again, we do not have any plans to make any updates to the current plan in place. If everyone does what they're supposed to do as far as wearing their mask, social distancing, washing their hands, doing your weekly testing, so that if you do test positive, we can follow the proper procedures to quarantining. Get vaccinated. I can't stress that enough. COVID isn't going away. We can see that clearly. And one of the best ways to fight against the spread is to get vaccinated. And I know the superintendent and the board are going to work toward requiring staff to get vaccinated. And eventually we're going to start having conversations with the community on what it'll look like to require vaccination from students. There's going to be a long road ahead of us, but the only way we can do this is together.
Yes. And so thank you. There's a lot more conversation. Families, you've heard Crystal, who is over the whole area of communication, to please opt back into the robocalls, and to also speak to your principals and making sure that there's a two-way conversation, that you understand what's going on and that you have the opportunity to talk to leaders at your school so that you can make sure that your children and your families are safe. Crystal, all to you and Dr. Vitti and your whole team, our best wishes, and let's stay connected. Let's make sure that we're getting information and know that we are here to support you in this incredible work of trying to keep our children safe and educated and emotionally stable in this period of time. Thank you so much.
Jametta, before you move on, Crystal, I thought this was really important. We had on our Spanish interpretation line, we had a parent that said several parents have noticed. This is parents from Western International High School. Several parents have noticed that school metal detectors have been turned off. We brought it up to the school officials and no one has done anything about it. Why are they off? With what happened earlier this week, I'm not sure I feel safe sending my child to school. How do I know they're safe if they're not being checked? So I want to give you an opportunity to respond to that, but also if you could take that information back both to Western and to Dr. Vitti if you're not aware of the situation, so that we can give an update at a later date. Go ahead, Crystal. Thank you.
Yes, thank you for that. We are aware of the concern at Western. And again, one of the advantages of being in the city is the resources that are available. And I'm sure Mr. Blaine will speak to it as well. But the one thing we don't do is take safety for granted. And so we are aware that the metal detectors are disabled, but we also want to be clear that metal detectors won't prevent what happened the other day. Yes, it is a layer of security that people feel that we felt over the decades. I graduated from Osborne High School in 1993. We had metal detectors because we were afraid back then that the elements of the city were going to infiltrate the schools, right? Today, it's a very different reason why someone would advocate for a metal detector in certain instances. Because if you recall, last year around this time, we were saying disband the police, defund the police. We don't need them. So school districts are having very serious, hard conversations in terms of safety and security and identifying the correct balance to provide the level of resources that are necessary to ensure students and staff are safe and to ensure that the citizens in the school community are safe. Today at Western, it is closed because we did receive a social media threat that proved to be non-credible, but out of abundance of caution, we did close the school. So we have a team dedicated to monitoring all of the high schools, and we are going to take that concern under advisement and continue to investigate what's happening at Western.
Thank you, Crystal, and thank you, Jametta, for letting me interrupt.
No, that wasn't an interruption. That is why we are here. And we're very, very thankful that folks got that question to us, because this does need to be a two-way dialogue. We're not here to mimic a topic or just have talking points. It is for an exchange, and that was wonderful to have. So I'd like to continue to move forward in this discussion with our schools, and to ask Ralph Bland if he would come on camera with us. Ralph, you are the CEO of New Paradigm for Education, a number of schools that you have the responsibility for. I know this information that you've heard out of Oxford hits you at home, but how are you reassuring the parents and the students, as well as the teachers in your schools?
So definitely we want to send our hearts and prayers out to the community of Oxford and that horrific situation that happened. And we just want to continue to keep them in our thoughts. One thing that we often do every year, we have an active shooter training, and that training is done intentional just for these different situations. Combined in those situations like that have happened, we want to make sure that our staff is well prepared and trained, in addition to doing drills that would prepare us for that. It's very critical that we continue to keep our parents informed, and we have a great relationship with Detroit Police Department and our other first responders that often support our communities and schools. And so it's important that we'll make sure that our parents are also well informed of different of our hotlines and our resources that they can tap on of situations. But we often tell parents that if you hear threats, especially on social media, definitely call us or call the police and make us aware of that so we can act upon it.
Thank you. Again, asking parents to be involved in the protection and safety of their children. But as we think about this in the particular time that you're in, and thank you for sharing that you actually do drills for these types of scenarios, which unfortunately, who would have imagined that this would become part of what we would have to do with our children and our teachers. Ralph, could you talk about, given what we see where we are as a city, where we still have less than 40% of folks in the city or we still have 40% that have not been fully vaccinated, and that we've seen increases, unfortunately, in contraction of COVID. What are you doing, if anything, that may be different around your current COVID protocols? And have you moved to virtual? And what are those reasons why?
So a couple of things that we've done is that last year when the pandemic, when we had to go through the whole school year virtual, we did do virtual Fridays. And we also added virtual Mondays and Fridays for some mental health breaks, but also to make sure that families were aligned with families. So this year, going into the school year and where we are now, we do actual testing every Monday, and that's PCR testing. And in addition to that, we're offering at one of our sites to our internal school community, but also our broader community. On that same Monday, parents, adults can get booster shots. We're also giving the vaccine for students and children that are 5 and older. We're also giving the vaccine of Pfizer and Moderna, and the Moderna booster and the Pfizer booster. So we've partnered with Wayne Health, and they've been coming on campus ever since school has started, and we'll continue to do that throughout the year. So one thing that we looked at, and looking at the holidays and the infection rate, is that we decided this week after Thanksgiving that we would go virtual. And we felt that it was important, due to the spread and the increase of cases, that we felt we're focused on keeping our school community, but also the outer community, safe. So during that week where we're going all virtual, we also have testing on Monday. We're actually doing some testing today for our school community and students and families. And we're putting that out there to all our families to come get your children tested, and especially if they're not vaccinated. And we've been sending out information to parents and letting them know that even if, the common cold isn't common anymore. So yeah, we have to take care of our community and keeping others safe as well as our own.
Yeah, so thank you for some forward thinking, some forethought. Also, I'm hoping that not only have New Paradigm for Education families heard this, but if you are in a district or you're attending a school or charter group, is that every institution should be assuring that we're doing regular testing. Thank you for your leadership to make sure that you're partnering with Detroit Health Department. Of course, we're so excited that you're a partner with Wayne Health, as a Detroit parent network is also. And so we want to let people in the community know that there are mobile sites that will come to you, both for testing, but really so importantly for vaccines. And so the last question I'd like to ask you, because I know that we have to move to the next segment, is what would be any information that you would say to parents about how they should communicate with you as we get ready to go into not only this continued virtual timeline, but even across the holidays? What are the ways that schools can be in communication with you and your team?
So we often send out newsletters every Monday to all our families. In addition, we do robocalls on Sunday. And we also do a phone app that we're in constant communication with families. And the teachers also have phone apps where they get the message out to families. But we do want to get a message out to families. After the winter break, we are doing another round of testing that first week in January, twice within that week, to make sure before we return that we want to make sure that we're continuing to keep our school community and our outer community safe with two days of PCR testing. And then we'll continue our regular Monday testing for the entire school year.
Thank you. That's so important. Prevention matters. thinking ahead and planning matters. And we know how important this is. So Ralph, thank you very much for being with us. And thank you for the work that all of you are doing as our educators to support and love on and educate our families. So we want to switch a little bit from talking about, obviously, these important issues around education and hear from our physician community, because we've had some increases, and we're really so happy to be able to welcome back Dr. Cunningham. But I'm going to ask Rajeshri Bhatia if she would pick up the mantle as co-moderator and take us forward. Rajeshri?
Thanks, Jametta. Welcome back, Dr. Cunningham. Good to see you.
Hi, everyone. I hope you had a great Thanksgiving.
Yeah.
Oh, love that energy.
Yeah, I love the haircut, Dr. Cunningham. You're looking
Thank
good.
you.
Well, as before we dive into the the COVID piece, I just wanted to get your perspective as a pediatrician, with so many triggers that our kids are dealing with right now, from, the pandemic to the uncertainty around variants to getting vaccinated and potentially having school closures. And now this, what's happened in Oxford. How do we help parents? What kind of signs should we look for? What should we be doing as parents to support our kids' mental health?
Certainly. And this Oxford really hits close to where I am. My daughter rides with many students who attended there. And so my approach with her has been lots of open-ended questions. How are you feeling? Not, are you okay? Because I want to try and get them to talk. What do you think about this? How did it feel when you found out your friends were okay? I want to try and get them talking. Young kids are usually easier to tell. Teenagers sometimes will keep their feelings really close. So just letting them know that you're there to talk and try those open-ended questions. And sometimes they're going to ask you tough questions, and you just have to have an honest conversation about it. I also tell my kids, you have to be careful what's in the news. They're there to sensationalize and, get viewers. And we have to put things in perspective. Oxford, horrible tragedy. The new variant, is it bad news? Yeah, but we still have masks that are going to work and protect us. So the world is not ending.
That's really helpful advice, Dr. Cunningham. Thank you. Especially for our parents, with older kids. I think that idea of asking open-ended questions so that it forces a conversation is a really, really helpful.
And I think it's so important when families eat meals together, especially dinner, at least a few times a week. There's so much data that it helps kids avoid drugs, avoid getting into trouble, and it's the perfect time for these conversations. I also like talking to teens in the car because you're not making eye contact. And when you're not staring at each other, they talk a heck of a lot more.
So true. So true. Wonderful. Well, let's start talking a little bit more about COVID-19 and why are we seeing an increase in cases, children's cases?
Well, we're seeing an increased number of cases throughout the whole state. It's not just in children. And, I was at the mall recently. I had to go to Target, the grocery store. People are not wearing masks. And I understand people are tired of this, but if you're not vaccinated, you definitely need to wear a mask. But even if you're vaccinated, there's enough COVID. Everyone should be doing it. I just don't see people wearing masks. It's not a political thing. To me, this is just the science. I'm wearing a mask when I go to the grocery store. I'm running errands out there. It's easy enough to keep a couple in the car and I just put them on. That is the single most important step. And of course, I encourage vaccination, even against the new variant. I do believe the vaccine is going to offer significant protection. The people I worry about are the people who were never vaccinated. They're at the highest risk.
Absolutely. Absolutely. And I see the same thing about masks. We just flew over the holiday, and one of the things actually that gave me a lot of comfort was that masks were required the moment you stepped into the airport until you stepped out.
I'll tell you, New York City, I was there for a day over break. Boy, you had to wear it on public transportation. I went to a restaurant and a museum, had to show my family's vaccination. It does give you a little more comfort.
It does. It absolutely does. So as kids get their vaccines, right, we're now starting to see this blended environment of kids who are vaccinated versus kids who are partially vaccinated versus kids who are not yet vaccinated, either because the families haven't chosen to do it yet or they're too young. How do we help our kids manage that? Because they're talking about it too, right? So how do we help them manage and understand that there's still a range, much like we adults have to do?
There is. I think one of the conversations is important that we have a lot of liberty in this country and people make decisions what they feel is best for them and for their children. So I'm not trying to cast anyone in a good light or bad light. It's just a fact. I like to just, when my kids ask me, I give them the good websites like CDC, American Academy of Pediatrics, Henry Ford, where it's good information. I want them to be able to see it for themselves rather than hearing it from their parent. And let them ask questions. That's the best thing to do. I've actually really been happy about how many kids 5 and older that when we're seeing them in clinic, they're actually excited to get the vaccine and they're happy to help get that sense of safety. And again, the young kids aren't the ones who really wind up in the hospital very often, but they do bring it home to mom, dad, and grandparents.
Yeah, absolutely. It was a conversation we had to have as a family that just because you're vaccinated doesn't mean you can stop wearing your mask, to your first point, right? It's just an understanding what that means. As we're getting into, a new variant coming into play, can you just tell us very basically, how do we identify these new variants and kind of what is a variant?
So every time viruses and bacteria start copying themselves, they sometimes make mistakes. Sometimes the mistakes make it a stronger infection, sometimes a weaker infection. This newest variant is significant because it has lots more mutations than we've ever seen in any single COVID. There's just so many more there, and that's what the concern is. It was first detected in South Africa. I just looked at the country, South Africa's COVID cases, and they've really shot up over the past 5 days. So unless we're wearing our masks and getting vaccines, I suspect we're going to see something similar.
That's the scary part, right?
Yeah, and I don't want to scare people, but the masks are an easy way to protect ourselves.
As far as this particular variant goes, maybe it's too soon to know, but is it as Delta was a very strong variant. It had a big impact. What do we know about this one so far?
This has the same mutations as Delta in terms of how easy it is to transmit it. A lot of what we focus on is on the spike protein. This is the part of the virus that binds to certain human cells so it can invade us. And there's a lot of mutations in that spike protein. It looks like people who had COVID in the past, an infection, can easily get sick again with this one. We don't have great data yet on the vaccines in this variant. There's some computer modeling that suggests the vaccines will still be pretty good against severe disease. So I'm still pretty hopeful that we can nip this in the bud.
Mm-hmm. So earlier you may have heard we had a couple conversations about testing, right? And so the question came up is, what happens to a test, the swab, once it leaves our nose?
So it goes into a little plastic container, like a test tube with a tight screw. It goes to a lab. The lab will shake that up. So whatever's on the swab gets into this viral support culture. It's a fluid that makes the virus stay alive so we can test it. Then a little bit of that liquid goes into a machine and we look for the genetic material of the virus.
Okay, and so that's something so when we compare that to the at-home tests, right? Because obviously that's not happening at the at-home test. If we think about the most common at-home test, what happens there?
So there's 2 types of home tests. One of them is you put a swab in the nose and you put it in the little test kit and it runs right then and there. It will look to see if any of these virus proteins are there and it gives you a quick answer. They're nice, they're cheap, they're fast, but the accuracy is not as good as the genetic testing that we can do. There are a few home kits that you can collect a swab on yourself and mail it to a lab and they'll do a PCR. They're a little more expensive. The downside is that it takes longer to get back. You have to mail it there. They have to run the test and then they notify you. I think you're muted.
I am, thank you. So, all right, so that's helpful to know. Just kind of, we swab our nose, it goes away, and then we get a call. So it's helpful to know kind of what happens in the process. As kids are getting more vaccinated, just like with us, as adults, how do we know when a kid should be tested or checked out, and at what point and what kind of symptoms?
So right now with the amount of COVID that's so much common, I have a pretty low threshold. If I see somebody with the cold, I tend to test them. Mm-hmm. We're also starting to see flu creep up, and we can do on one swab, we can test for both flu and COVID. And that can be important because there are medicines we can give people by mouth that help you to get rid of the flu infection a little faster. If you have any medical problems or any risk factors like asthma or lung disease that makes you more at risk for COVID complications, you absolutely should get tested sooner than later so we know and we can figure out if you might benefit from some of these antibody infusions we're using to prevent severe disease in COVID patients.
Okay. And can you explain what ivermectin is and how it?
Ivermectin is a drug that treats parasites. So for those of us who had high school biology many years ago, you have bacteria, you have viruses, you have animals and plants. Parasites are kind of their own little category. Things like roundworms, very common parasites in other countries. Occasionally we have pinworm in this country and we can give a dose of ivermectin. Occasionally we'll use it for scabies. There's some people who advocate using ivermectin to treat COVID. And to be fair, in the test tube, it does seem to work. The problem is the levels of ivermectin you would need to treat COVID in a human person are far higher than the toxic level, which means it can make you have seizures or even die, which is why we're not using it. There's just no good data in human beings that it's effective.
Okay, so while we're hearing about it, that helps. So it kills it in a test tube, but in a human body, it would take so much that we would actually make ourselves sick.
Absolutely, and the number of poison control calls across the country have gone up for ivermectin overdoses because you can get it for certain animals that you keep in glass tanks, and you can get it for veterinary supplies, and then humans take it, it's the wrong dose, and they wind up in the emergency room. We don't want that.
We don't want that. Okay. All right. And lastly, before I let you go, as kids are getting vaccinated, just like with us, any idea of when kids will need a booster? Is there a timeline for that?
Yeah, we don't have that data yet. So I would expect we'll know about the booster doses for healthy kids 12 and older, probably by early spring, 5 and older by late spring.
Okay. So with enough time before they get into that window of where they would have less protection.
Absolutely.
Helpful to know. Wonderful. Thank you so much, Dr. Cunningham. We love having you on and appreciate all of your words of wisdom.
It's always my pleasure to see everyone's smiling face.
We look forward to seeing you soon. Jametta, you want to take us home?
Yes, absolutely. And then just to say again how much we appreciate not only your medical advice, but reminding us as parents the things that we need to do to stay engaged with our kids. Talk often, open-ended questions, and find all those opportunities to listen and engage. Well, there's probably no other time that we need to stay connected to our kids except when they hear these kinds of tragedies. So we have a number of resources that we would like to share with you. And I'm going to ask Deja if she would kindly bring on the slides that we think can be helpful families. There are tips now. We have tips on coping after a school shooting. And obviously there are those mass shootings, but the reality is for many of us who live in urban environments, we know that shootings are too common in almost every other day experience. We have to talk to our young people about this. So this is a slide that we would encourage you to save and keep it. We want to thank Caleb's Kids for providing this information. Families, please take advantage of these 7 tips for coping after a school shooting, which could be either a mass event or the sad reality that this is happening far too often to our children throughout their school lives. The next slide, please. Here are some additional resources because the reality is that we know that we have families and young people who are experiencing this trauma. And it's leading to significant changes. And some of those changes that we're seeing is increases in suicide. We're seeing increases of what it means for those people that are veterans. Here are some resources that we encourage you to please take right now so that you and your family can have these resources to talk to. Because during COVID, we simply don't have the same access to each other to engage. But please, please, families, take this information. And while we're talking about families and we're talking about the struggle of how do we stay powerful, how do we stay loving, how do we stay focus on our future, we at Detroit Parent Network are doing just that. And we encourage you and welcome you to join us on this Saturday, which is our next annual meeting. And that is Saturday, December the 4th from 10 a.m. to 12 p.m. It's free. It's all virtual. And we have had wonderful workshops leading up to our main event. But also we want you to please join us tomorrow because we are doing an equity cafe with a phenomenal Black woman, and that's Carla Walker Miller, talking about how she as an entrepreneur is helping to move the city forward and how parents can be powerful to create more entrepreneurs in our communities. We have some other great events that are coming up. We have a toy drive, and you can take a look at this slide and see the great work that is happening in the Southwest Detroit. So this drive is recognizing that not every family is having the opportunity to create these resources for their children. We also want to thank Molina Health, which is one of our partners in so many different ways, along with other Medicaid health plans. But Molina is doing a Hope Coat Drive. Community, they have coats, and this is how you can get them. They're doing a drive-through on December the 18th. Please copy the slide so that you can make sure that either your family or an organization or your church or others can take advantage of this. Another opportunity for us to stay connected is through our Detroit Youth Summit. Young people coming together to talk about what their destiny is going to be. We want you to please join them in an ongoing series that starts, in fact, this Saturday. The next slide that Deja put up is from some of our other upcoming activities. We'll see here that we want you to have more fun with virtual learning. We thank our folks at Wayne County Community College Districts with their Kids College. Enroll now. Please make sure that we're exposing more of our children to think about college as being a natural part of what is in their future. And what better way to do that than getting the young people involved in virtual learning in a college environment. And then if we're talking about college, we have to talk about our voting power and how do we make change happen and how do we create more accessibility? Well, we do that by having dialogue with our legislators around equity. And we love it. 4824 has a desserts and delegates. So come together, have some sweets to talk about while we talk about substantive issues with our legislators. And so that is upcoming at 4824. And last but not least, we want to thank the folks that are in our community throughout Southwest in particular to make sure that we are focusing in on our financial health and with financial aid workshop. There's one that is upcoming and it's going to be in your community. You can register as well as use the QR code that is on there right now. That is coming up December the 3rd. So we want you to please take advantage of that. So that was a lot of resources. We're here always to make sure that you have information that we can use to keep us safe, to keep us strong, to keep us powerful, because we are in increasingly uncertain times. But we know this, right? COVID313 Coalition, if all of you can come on, we want you to know that working together, supporting each other, loving on each other, staying masked up, looking at the science, that together we will be able to make it through this. Thank you so much, and we'll see you soon. Take care, everyone. Bye-bye.